Another day, another daily record, with cases in Queensland and the NT almost doubling and Victoria surpassing 20,000. That's more than 72,000 new infections recorded around the country. But as we move away from relying on PCR results and start to embrace at-home rapid antigen testing,
case numbers will be underestimated in Australia.
So in a bid to manage that,
states are now working on a process for reporting where they move to rapid antigen tests which are being done at home.
So far, we know that from tomorrow, Victorians will need to lodge their positive result with the Department of Health. South Australians will be sent a QR code to register their RATs, while in Queensland,
we're working on a system at the moment so that we hope people will be able to notify us very easily that they have got a positive rapid antigen test.
That doesn't have to be the same in every state and territory.
But with unmanageable PCR testing lines and rapid tests near impossible to buy.
Don't even start with me. It was like a fight to get a rapid test. We went to all these different places.
Epidemiologists believe the true number of cases in the community could already be 10 times higher than what's officially reported.
So this is already kind of pointless.
The reality of living with COVID is here, but is the peak anywhere in sight?
That is the nature of Omicron. You've just got to keep pushing through.
Well, epidemiologist Tony Blakely joins us now. Tony, what do you think the real numbers are?
Well, I think it's roughly 5 times the number of case notifications. That kind of agrees with estimates being used by one of the US premier health metrics organisations. So if we think about New South Wales, that means 35,000 cases means 150 to 200,000 infections per day, which is quite something. But the good news is with that many people being infected every day, you're starting to run out of new people to infect. And this wave, at least in New South Wales, will peak quite soon and then probably come down quite quickly. And then it will follow that sort of pattern in Victoria, then Queensland, Northern Territories and the rest of the country.
Well, I guess that is a silver lining to see that we are closer to the peak of this wave than we thought we would be. Is there any indication of when it might start going down?
Well, it's too hard to predict. If you really force me to, I reckon New South Wales is going to peak in the next week, might even be peaking right now. But in the other states, it'll be delayed by approximately the amount of time that the wave started in those states and territories. So it will come down, and it may come down quite quickly because not only is the infection chewing up susceptibles, but we're boosting at the same time, which is also diminishing the susceptible pool. So it's going to go up quickly and possibly come down quite quickly as well.
Tony, without any warning to GPs, the Prime Minister announced that he wants everyone who tests positive on their rapid test to register that with their local GP. I mean, for a system that is already under pressure, what's that going to do, particularly if the numbers you're talking about that are currently not coming through on PCR tests? I mean, what are we doing to our GPs?
Well, it's actually an extraordinarily bizarre statement and may belie why we've had such a major policy failure with rapid antigen tests. The failure is enormous. We should have had heaps of rapid antigen tests in the country because even the Prime Minister, as well as the Chief Medical Officer, as well as commentators like me, we've been talking for 6 months that we're going to pivot to using lots of rapid antigen tests, and we don't have them in the country. And as well as that, we don't have the surveillance system that allows you to lodge that information up. And it's not through the GP. As here in Victoria, they're getting something in place pretty quick, a pretty simple solution, whereby they're going to give you a phone number and you just ring up as of tomorrow and lodge it in and somebody will type in onto their IT system. But to me, it just belies how disorganised this federal government is.
Tony, you mentioned the boosters before and also this tsunami of case numbers. Does that put us in a better position to handle whatever variant might be next?
Yes. I think the case is getting very convincing that that's the case. So in 3 to 4 months' time, once we've gone through this Band-Aid ripping pain, we could be in a very good, resilient place. We'll have the population largely vaccinated, including kids. We'll have a lot of people boosted, and we'll have somewhere between 1/3 and 2/3 of people would have been infected with Omicron. Most of them won't even be aware of it. And that whole package will make us more resilient. something like herd immunity, not quite herd immunity, but more resilient to whatever comes at us next. And I'm hoping, I can't guarantee, I'm hoping that this will be our big wave, and then after that it'll just be small shutters that come through and that will cope with a lot more easily.
Tony, you just mentioned at the start the numbers that you think that are taking place in New South Wales each day. Nationally, what numbers do you reckon we're hitting?
Oh, we'll just multiply it by 5. That's my rough estimate at the moment. It is very rough. I think it's near enough though, because when you look at each state and territory as you go around, whether you multiply by 5 or 7, the numbers are big and you're quickly going to use up the susceptibles there, and it tells you that this will pass through quite quickly. So the estimates in the US by an agency I trust suggest that there's going to be about 40% of people, 40 to 60% of people infected with Omicron over the course of the next few months. So this is really infectious and it spreads through society.
And do you think the peak will be able to go down the other side when schools are going back? Because won't that circulate it more?
Yeah, it's a really good question. I think it was Hamish. Yeah, good question. So when the schools go back and when we change after the holidays, we change our social networks, and that might cause a sort of second hump on the way down. We'll have to wait and see, but that type of re-engagement in different environments might see a little bit of a kick up. But the kids you'll hardly see much symptomatic cases at all amongst the kids. It'll be pretty silent. They'll have had one dose of an mRNA vaccine by then. It won't be brilliant for Omicron, but will also further take the edge off it. So as it comes down, it might do a little bit of a bump like that when the kids go back to school.
Tony, thank you very much to you and your fabulous shirts. Good to see you.
Pleasure.